Hello, I have chosen to do the age 43 history of present illness, include a currently admitted to your floor for 23-hour observation after a single vehicle motor vehicle accident in which the patient was unbelted and hit the steering wheel at moderate speed. There were several fractured ribs on the patient's right side, but no other injuries were noted. You are calling for discharge orders for the AM shift when the patient puts on their call light, complaining of severe shortness of breath. You assess the patient and note absent lung sounds on the right side, anterior and posterior, as well as a slight tactical deviation to the left. Past medical history included diverticulosis times 4 years, occasional lower back pain controlled with over-the-counter NSAIDs, and tension headaches. Medications are propanazole, 20 milligrams QD, lactated ringers to keep open, and Percocet for pain. What is your next actions? I would make sure that the patient applies some type of pressure to the chest cavity because I believe that this patient is experiencing atelectasis, which is a collapsed lung. Make sure to apply oxygen as soon as possible to the patient. The thoughts that I'm having of what is happening is related to a collapsed lung, especially because it is noted in the present illness that he was unbelted and hit the steering wheel at a moderate speed, and he had several fractured ribs on the right-handed side, and all of the breath sounds are absent on the right side as well, again leading me to a potential diagnosis of atelectasis. What do you think got the patient to this point? I would say the fractured ribs were identified, but what type of interactions or potential complications can be affected from the ribs that were fractured related to the lung because it's in the same area? Diagnostic test I recommend would be a CT scan stat to see if in fact that this lung is collapsed. I feel that these current medication regimens are appropriate. Would you add anything? I don't think at this point I would add anything because the Percocet I believe would be helpful to reduce the lung the friction that the patient may have on the lung related to the fractured ribs, to make sure that the patient is still utilizing full breaths in and out, just because a lot of patients, when they do have fractured ribs, it is hard to make them take deep breaths because it is painful for them. I would also be concerned of the lactated ringers to keep open. And the reason for this is because we could potentially compromise the one functioning or fully functioning lung by fluid overload. And we also want to be on the lookout for potential bleeding complications of undiagnosed injuries, especially internal bleeding. This would be my assessment. Thanks.